Alrighty, so we're going to discuss pre-op for your blepharoplasty procedure. So any procedure where we're talking about the eyes, whether it be kind of a brow lift or blepharoplasty, these are pretty much the same pre-ops we do. We're going to take photos of you ahead of time. Excessive makeup or eyelash extensions can be a little bit of trouble for our photos, so it's better if you don't have those when you come in for our photos. Stacy's going to see you for your pre-op visit, and she's our physician's assistant. She's going to be the one taking photos of you. What she's trying to do is really document the best she can the excess eyelid skin that you have, any fatty tissue herniation that you have, and especially with some of the eyelash extensions people have, or with too much makeup, it can hide some of those characteristics of your eye that we're going to be trying to treat. And when you lay down, our eyes look different than they do when we're standing. So in surgery, I often refer back to those photos to see subtle little differences to help me know exactly how to do your surgery. So it's important at your pre-op you come there prepared to take those photos so we can document your condition the best we possibly can, so we can treat it the best possibly can. Additionally, Stacey's going to be giving you prescriptions for 3 different medications: a pain medicine, which probably you won't take because most people don't take it, but we give it to you just in case. An antibiotic, which we recommend you take after surgery, and an anti-nausea medicine, again, which you probably won't take because just for an eyelid surgery, most people don't get nauseated post-operatively, but we want you to have it just in case. One of the important things post-op that we want you to know about eyelids, and that Stacey will talk to you about during your surgery, is there's certain positions you want to have your head in after an eyelid surgery. So after an eyelid surgery, we're going to have you keep your head elevated. You're going to sleep with your bed just a little bit elevated. And that first night, you're going to be putting gauzes on your eyes. And Stacey will talk to you about that first post-operative night during your pre-op and explain some of those things to you. You will need somebody who takes care of you post-op, like with all of our surgeries, just to make sure they can provide you with adequate care. Plan on having your eyelids swell just a little bit post-op, because that will be the case. Many people plan to read things afterwards or watch movies afterwards. In the first couple days, that might be hard. Hopefully you'll be able to. But the good thing is there's not a lot of pain after surgery. Additionally, as with all of our surgeries, there's a surgery packet that you'll be sent from our patient coordinator, Samantha, and she's going to send you a packet that tells you all about your surgical procedures, talks about risks, complications. Super important you read that stuff so you come to your pre-op visit primed to be able to ask any questions, so that we can give you the best information and tell you as much about your surgical procedure as we possibly can, so you can be a good participant in your own care.
Again, make sure that you have that packet read thoroughly. You will receive it via email, and sometimes it doesn't get to your email. It may get into your junk email. So make sure you check your junk email and read through it thoroughly before you come in. You will be signing those consents that day of the day of your pre-op appointment. You'll also be given the prescriptions, and I always tell people to make sure they go and get their prescriptions right away within a couple days after I prescribe them. You may be getting some eye drops. Dr. Green did mention 3 medications, but if we're doing both your upper and lower lids, or maybe sometimes just your lower lid, you may be getting some medicated eye drops that will instruct you how to take those. You only use those for a few days after surgery. People get really confused as far as hydrating their eyes and then using these prescription eye drops. So just make sure you read what the medications are prescribed. We also recommend that you make sure we do sometimes request you getting a medical clearance or an EKG or some labs prior to your surgery. We want to make sure that you have those completed before you come in for your pre-op. Super important that you have those done before, to make sure we don't have to delay your surgery at any point. I think that's it.
Alrighty, there you go. There's your eyelid or blepharoplasty pre-op.